guys see me okay?
Yes,
Perfect.
good. Thanks again.
Yep.
And I'm glad I see you after a few months.
Yeah.
So Daniel's story has some unique aspects. First of all, he's a male patient, which is unusual in this context, and but also as he's going to explain to us, his symptoms, his his hobbies are important. We'll go through this, So without delaying things further, Daniel, you can start. This is going to be mostly you talking. I will ask some questions when I think something needs to be highlighted, and I will obviously have some questions from people who watch us. That would be also for you to comment.
Yeah.
Go ahead.
Awesome. So thank you guys for having me. I'm really glad to be here to help in any way I can, regarding this issue and condition, I guess. A little bit about myself. So my name is Daniel Massara. I'm a half Lebanese, half American, 26-year-old healthy looking male, I would, try to say about myself. And I had been dealing with pulsatile tinnitus for about 6 months when I saw Dr. P. And it's been quite a journey. It's been quite a really difficult thing to like deal with and talk about, but I'm glad I'm able to share my story kind of here today. So without delay, really, I first started to experience symptoms of pulsatile tinnitus when I woke up in around early May. I just felt a whooshing sound in my ear, and I was like, what is going on? And I tried to blow into my nose and try to pop my ears or something like that, and I thought that was the case. But it just kept going. So I kind of started, okay, this is weird. And I wasn't at the freak out point yet, but I had decided, let me take the day off work and go to the emergency room to try to figure this out. I went to the emergency room here. I live in Michigan, so I live in Ann Arbor, which is next to the University of Michigan. Went to the University of Michigan hospital. And I spent, I think, 12 and a half hours at the ER because of how busy it was and how everything was so chaotic and crazy. And this was still people were suffering from COVID, and a lot of the ER space was for that and trying to mitigate that and stuff. So once I finally got in, like 3 hours, 4 hours later, I was seen by multiple doctors. They had me see an ENT. They had an ER ENT, a neuro doctor, just general other health doctors. I'm not entirely sure who saw me doing a bunch of like field tests, and then they kept telling me nothing was wrong and that I should go home and try to sleep it off or have some pain medication. And that was like kind of first step of I think this is something really wrong. So being the person that I am, really, I started to obsess a little bit. I have a lot of anxiety about it, but I started to obsess a little bit about what it was. Googling, I hear something in my ear that sounds like my heartbeat, and like getting inundated with different kinds of information of what it could be, and people saying, oh, you have a tumor, or, oh, you have this and that. And I know you shouldn't WebMD yourself, but just trying to figure out, because I'm an engineer, I have no knowledge about anything medical or biological. I leave that to the experts. So just looking at what I could do, and then I was like, okay, so a lot of people seem to think it might be an ear thing, maybe I should go see an ENT. And that was kind of the next step. So trying to get appointments with different doctors, that was also really difficult, because people need to like be aware that you can't just call a doctor up and get an appointment the next day. It kind of has to take its time. So dealing with it for a couple of weeks, I started like going crazy. I'm like, why isn't this stopping? This is something that it's weird. I feel it every day, I hear it every day. My sleep hasn't been getting better. There's no silence anymore. And it was constant. It was very in sync with my heartbeat, which was super important to the context of my case, I guess. So it was dealing with it 24/7. It was really hard, but when I would fall asleep, that was kind of a little bit of the the nice times that I would have. So I went to an ENT around here, I think a couple of cities away. So it's not too far, maybe half an hour. But that was the first time I spoke to the ENTs, and they checked my ears, and they said, excuse me, they said that there's nothing really wrong with your ear. There's no thing that, excuse me, that is wrong with your ear. Excuse me. And there's nothing that they can see like visibly by checking the ear and the inside and outside that's wrong. There's no inflammation, there's no, growths, nothing like that. But they then referred me to another specialist ENT, and I went to that, appointment a couple of weeks later. Same thing. Then they referred me to a third ENT specialist, and that was, even 3 weeks later. So this has been the span of like maybe a month and a half or two almost at this point, where I still have no answers. And that third ENT said, it really doesn't seem like anything, but I'm gonna refer you to a bone plate doctor. The bone plate doctor is down at the skull, the base skull surgeons, and we'll see that. And I was at the time going to the Michigan Ear Institute. At the same time, they also asked me to go and get a hearing test. So I did that, which I had also, normal results, I believe. I think I had like small, like high frequency hearing loss in my right ear, but it was very negligible. So I also did that. Then I went to the base skull surgeon doctor at the Michigan Ear Institute, and he checked my scans. At this point, I had done, I think, an MRI and a X-ray, and that was back, and a CT scan, and those were back when I was at the ER the first time. I had done all three. He checked those out, and he said that I had the bone dehiscence, and there was nothing I could do. And I looked at him, and my mom was in the room at the time, and she was like, okay, what can we do? You're gonna have to live with this. And I was like, I can't accept that. Um, and I went home very upset, and I could barely focus on work. I'm also in grad school, so I could barely focus on grad school as well. And for my hobby, which I think Dr. P alluded to, I'm a powerlifter. I've used to play soccer my whole life. I was a big soccer buff. I still watch it all the time, but right now my kind of hobby of choice over the past couple of years has been powerlifting, which is, if people aren't aware of what it is, it's when you perform the squat, bench, and deadlift in competition. And I've been competing and working, and I created the powerlifting team at the University of Michigan too, and we've been growing ever since. So that was kind of my side hobby, and I was doing that a lot, and it's kind of important because when you powerlift, there's a lot of difference in I think blood flow at the head level, right, Dr. P? Yeah, you're nodding your head. So it's a lot of transient blood flow stoppage, and bracing really well and lifting really heavy weight. So that's still what I was doing. It was my side passion. So I was still using the gym as kind of like my release. And sometimes when I would really, push and get my heartbeat pumping and getting up, the whooshing would kind of subside a little bit. It would still be there, but it wasn't, as prevalent. So after I saw the base skull surgeon, and he said the dehiscence was the main problem and I couldn't do anything about it, he was like, I will kill you if I perform surgery to put like a little cement on that. I still kept digging, and that's when I found the group on Facebook, which has become, I think, a bit famous in the PT world right now, called the Whooshers. Um, and I went down, little rabbit holes of like what this could be and what's possible, what's not possible, and growing frustrated with people seeing patients saying that, oh, I've been dealing with this for like 8 or 10 years, and I was thinking, I cannot do this for 8 or 10 years. This is gonna drive me nuts and crazy. Um, and I have a bit of an obsessive personality when it comes to like things that cause me some anxiety. So it almost got louder every day because I kept thinking about it, and that's, I think, the biggest driver of like how I kept just advocating for myself a little bit, for what was wrong. And by this time, like, I had maxed out my my out of pocket maximum deductible on my insurance, and I was like, okay, I have free reign. Let's go full throttle on this. And then I was researching what some doctors who have been like specialists in this, and that's where I came across Dr. Patsalidis. And I looked him up, everything, and he was in New York, and my sister was living in Brooklyn at the time. I was like, you know what, let's do it, let's go. And I got a virtual appointment with him, to talk about my case a little bit. And when I did, I explained to him my symptoms, and of course, because I was an out of state person and not his patient, he couldn't really properly say what was wrong, but he did recommend what I could do. And then I eventually you know went and got an actual appointment to become one of his patients. And that's where I think my process to recovery really started. And that's, I think, what I had done previously meant nothing. And I was glad, I finally found it, because that's kind of where the ball started rolling on what I was actually experiencing. Parallel to this, I was still powerlifting, I was still going to the gym, and I had a competition in July, of 2022, and I did that while my ear was raging, and it was one of the best in my life, to be completely honest. But a couple of weeks after that was when I started to notice that my eyes were hurting. Um, and that's where kind of like alarm bells started ringing of like, okay, what's going on? So I went to the Kellogg Eye Center at the University of Michigan, and we kind of, started looking at symptoms and stuff and eye exams and, peripheral vision exams and everything. And they didn't really know what was going on. And then the headaches started. And that's also kind of what led me to keep going and asking for, more tests and more things that I could do here locally. And in the meantime, I was still waiting for my next appointment with Dr. P. And then they eventually said, okay, we're going to refer to you to a neuro-ophthalmologist, I believe. And then before I went to the neuro-ophthalmologist, I had spoken to Dr. Patsalidis, and he said, okay, let's see the scans. And he looked at my MRI that I had done, and he said that, yeah, I see one of your veins has stenosis in it, right? Um, and I had asked him, well, that's weird because the two, X-ray specialists who did my X-ray or who did my MRI, excuse me, said everything looked normal, and I had like a high riding jugular bulb, and that was kind of it on my right side. And then, he saw it and he found it, and he said, "Yep, I think this is your problem, but you're telling me about some eye pain, you're telling me about some headaches. Let's go test for something called IIH." So that's what I did. I went to my neuro-ophthalmology appointment, did a bunch of different tests again. They referred me to do a spinal tap. So I went and did that, and they had said, oh, you need someone to drive you back home. We're going to pump you with medication. And I was like, no, I'm going to do this myself. Um, and it went fine. Everything went smoothly. I think I had an opening pressure of, I believe, 38.
Correct.
Yeah, 38. And a closing of like 17 or 16, something low in that low range. And that was kind of really the confirmation that Dr. Patsalidis needed to confirm I also had IIH. And I think the timeline is a little bit important here of saying I got the pulsatile tinnitus. It progressed for a few months. I got the IIH after that. Like when I first started hearing the whooshing in my ear, I had no eye pain and no headaches. Nothing was going on. Nothing was wrong. Um, so discussing kind of then what were my next steps, it
Daniel,
was,
I will
yep.
interrupt you because I think
Mhm.
there's a couple of good points.
Yep.
Give you a break first and then,
No, you're good. Thank you.
but also I think there's a couple of good points that I think you already made them, but I want to highlight them. One is that, correct, there are three possibilities in patients with venous sinus stenosis in terms of the symptoms. One is, the pure pulsatile tinnitus or isolated pulsatile tinnitus. The other group is that they present with IIH, and the more rare group is the ones who progress from one category to the other. And so you are that patient, right? You started with pulsatile tinnitus, with no headaches, no vision problems, and then you ended up developing the feeling of pressure. I think something you didn't mention is that I think you reached a point when you're like powerlifting that you would lose vision for a few seconds.
Oh, yes. Yes.
I
So,
think this is,
yeah.
go ahead. Yeah, and then I want
Yeah,
to
that was
that.
that
Correct.
was I think early August by that time. And I was starting back up from, preparing for my next competition, which was supposed to be in November. And I was like, it feels difficult. Like something feels wrong when I'm lifting. And I went to do a squat, and I had like I think 350 pounds on my back. And on my way down on the squat, I blacked out. But I was still awake. I just couldn't see anything. And, I was freaked out. I got up, put it back, and then my vision started to slowly come back. And that was where I was like, holy shit, I need to stop. Excuse my language. But I remember that day very well. That's where I was like, no, this is something really wrong with my head now. This isn't an ear thing. And people still come up to me to this day, and they ask, "Oh, how is your ear thing?" And I correct them. I'm like, "This had nothing to do with my ear. It was all to do with my head." Um, so I think that's also a little bit of like a misconception people in the PT world. I think that I have seen at least. They always go to an ENT first, and that's because they think it's an ear problem because they can hear it. And it might be an ear problem. There's multiple causes. I know Dr. Patsley probably will go through them, but um, that's kind of everyone's first reaction and first instinct, and it's there should be a little bit more of education towards it. But
The
yes.
the explanation on why you lost vision during powerlifting is because when you guard your torso and you strain yourself to lift the weights, then you essentially at that point you are increasing the pressure in the head.
Mm-hmm.
Even under normal circumstances, this happens. Like even if you don't have venous stenosis, the blood just doesn't come down to the chest as
Right.
in its normal fashion, just because the pressure in the torso and the chest goes up a lot. But that's even more so in your situation with the venous stenosis. So at that point, basically the pressure in the head goes exponentially higher.
Mm-hmm.
And that's why you had the transient vision loss.
Right.
So but again, you progress from one group to one category to the other very quickly.
Yeah.
And within a few months. And I think that's an important piece of the story here, because there are many patients who will say, they have pancreatitis for like 15, 20 years, no headaches, no vision problems. And there's the patients who are present with primary IIH, but there are also patients like you who they start with one and quickly move to the other.
Yeah. And, it was funny too, because my mom would come and talk to me and tell me, oh, it's because you're powerlifting. And then I tell her, well, the thousands of other people who powerlift, I've never heard or seen of anyone. And I think that's kind of important to like my case as well, that Dr. Patsalides wanted to highlight, is because I'm not a typical patient. I am typical, I would say, of like the people who experience this. I'm not, you know, a woman in, I'm not, overweight. I can't get pregnant, obviously. So, it's that I'm not a typical case of a patient who would experience this, and I was pretty young too, and nothing is wrong, or I hadn't been doing anything unhealthy, or um, you know, eating wrong or eating different than I would normally, or anything like that. So I wasn't really doing anything different from my own normal routine. And that's kind of the importance of why that happened, I guess. So yeah, like I said, PT transition to IH, still hearing still hearing it as well. That's after when I did the spinal tap, we found out exactly how much the pressure was, and then the decision was, okay, so what do we do from here? And there were kind of two paths that we had discussed, and the first one was we can go and do surgery right away, and then we can put a stent into the vein if it was a viable option to do so. And the second one would be, okay, since I am presenting with IIH, let's go ahead and get on some, head pressure medication, and that was, I think, Diamox. So I spoke to the, neuro-ophthalmologist locally here. They then prescribed me with Diamox. I think I was on 500 milligrams twice a day. I think that was like the lowest dose, if I'm getting that correctly. I've tended to like block that medication in my mind because my experience with it was very, very rough. So after I got that prescription, I spoke to Dr. Patsalides, and then we had decided, okay, let's try it out for a month and see if this is going to help you. And at the same time, I had everyone at the Kellogg Eye Center at Michigan tell me surgery will not help you. And I think that's also important because they were very quick to dismiss the surgical option before even discussing it or considering it, whereas someone like Dr. Patsalides was like, no, let's look at both. We can explore something first. If we exhaust our medication options, then we can move on to like thinking about surgery. And that was like, I think, a factor of why I put a lot of quick faith and trust into Dr. Patsalides, because I felt that he had a lot of my best interest at heart too, especially telling me, listen, we're going to get you back to lifting. We're going to get you back to, where you want to be and get you back to normal. So I was very, excited by that prospect, but also very scared because I thought that maybe I wouldn't ever, get back to that. And he did say that, that might be possible. So it was a very, real scary time for me of what could really happen. So I tried the Diamox out, and, the residual effects started to come, I think, a week in. And I had been warned, and I still couldn't have been prepared for it. I had the little numbness in my fingers and toes, and that was really worrisome. I had trouble focusing. That the brain fog was huge. I would forget so many things like during the day. Irritability was through the roof. At that time I had started. I was in a relation. I am still in a relationship, but my partner moved
Be careful
away.
what you're saying. Huh?
What was that? Yeah, right. I don't think she's here, but she had just moved to Boston, so we were doing long distance. That the irritability there was really rough on us too, and it just made me into a different person, and I think that was the main thing that I can take away from this experience is like for that 6 months I didn't feel like myself at all, and it was horrifying. Um, and sometimes after the Diamox stopped, I still feel a little bit of residual effects of like trying to remember things before I had PT, and I really can't. But also that could be attributed to some anxiety about it. It was just a rough time overall. But we had decided, okay, let's try it. And I think a couple of weeks, and I called and I was like, let us schedule this. I can't do it. I have to, I think the surgery will help, because the main thing was Dr. Patsouris asked me to, monitor my whooshing sound. And if that subsided, then maybe IIH could have been the cause, but it didn't go away. It didn't even, decrease in volume at all. It didn't decrease in intensity. It was prevalent. It was just there. So then the decision was made, okay, so we do feel like the sequence and timeline of events of like PT developing into IIH, that was then PT is the root cause. So I scheduled surgery day, and that was in October 5th. And I was very, excited and nervous to do it. My sister was living in Brooklyn at the time, so I decided I could stay with her. We rented a car, and then we started our commuting to Long Island, to Northwell Health. And that's, first day was, I think, just a COVID test. After I landed, we did a COVID test. Second day, I came in, spoke to Dr. P, and Kelly, and we spoke about everything that was going on. We reviewed all of the scans that I had recently done as well, just to confirm everything was going fine. And I was still on Diamox at this point. And then I got my blood thinner medications for pre-op, and everything was fine. The morning of, I went in super early in the morning. Checked in, everything was great. Really, honestly, like the nurses and everyone who was taking care of me that day was absolutely fantastic. I felt very at ease, I guess. I was, of course, pretty nervous because I had never also been under anesthesia before, general anesthetic. So, it was like a first time event for me, and everything was weird and crazy. But I think I had a comfortable time, and everyone there was, very accommodating, very helpful, and very, knowledgeable about what's going to happen next and what are we going to do. And then I went into the room. I walked there and into the room, and then sat down at the table. There was a bunch of other, doctors and nurses there, prepping me and getting me ready, and telling me, oh, you're gonna feel a little pinch, and I felt nothing, like the regular story. And then, yeah, I can't get too technical. Obviously, I don't know the technical specifics, but I was awake for the first half of the procedure. I think that's where Dr. P, you confirmed that the stent is actually going to be a viable option moving forward, right?
Correct. We confirmed the narrowing. You had
Mhm.
significant what is called gradients across the narrowing, meaning there was a significant, backflow or pressure buildup as a result of the narrowing of the vein. Then that kind of like essentially means that stenting is destined to help.
Mhm.
So
Yeah, and I was, semi-awake, transient awake with all the drugs pumped in me and everything, but I was asking him, okay, he was telling me, look, you can see it in the scan, and I was like trying to look, and I couldn't really make it out. And then I was asking him what caused it, and that's where kind of like really I was eager and itching to know, like, okay, so why did this happen to me? In my case, in my scenario, and like I can let you like explain that, of course, but that was where I was, very eager to understand why me, because I think a lot of people suffering from PT are like, why is it me? Why am I hearing this and other people can't? Why do I have doctors telling me I'm crazy? Doctors who are supposed to help you, they'd say that you're crazy and you just have anxiety and you should be on anti-anxiety meds. It was, it was like a full circle moment of like, okay, now I know what it is.
good, yeah. Your scans, like both the MRI scans, MRV scans, and the venogram. This is the name of the the first part of the procedure. That showed that you have what is called intrinsic stenosis. Like essentially, the narrowing of the vein is caused by a problem within the vein itself. And there's like two big categories of these. Like an old blood clot is the less common cause. The far more common cause is something called arachnoid granulation, which is the arachnoid granulation is a valve that normally exists in the wall of the vein, but it should not impair blood flow. It's like a very small and flat, if you want to say this, against the wall. But in some cases, and we don't really understand very well why, but it could be an inflammatory condition, it could be a hormonal change. We see that a lot in younger patients, especially women. Then these valves overgrow and they impair blood flow. And that was causing the stenosis in your case.
And I guess I could ask you a question because now I've my curiosity. I know this is a panel about me, but like, does that something that develops over time to like eventually pop up? Because I wouldn't have known that I had something like this until I got PT, like until I started hearing it, right?
Correct. This develops over time, and this is not something you're born with or something that happens, early in life. I think it's very common in young patients, like I'm say 20s, 30s, who have pulsatile tinnitus. And yes, I think it forms or it happens actually right when you hear the pulsatile tinnitus. I think that there is not much lag time between when this happens and the pulsatile tinnitus develops.
Yeah. So
Also,
continue. Oh, go ahead.
Sorry to interrupt you. This is the common, when I say the different types of venous stenosis, this type of venous stenosis or venous sinus stenosis is what essentially causes the high pressure in the head.
Yeah.
So with patients like you, hopefully at some point they'll reach a consensus in the medical community that we are not going to call it idiopathic intracranial hypertension, because it's completely misnomer at this point.
Right.
There's nothing idiopathic about this, right? But that's
they're not sure right now, so that's why they call it.
Right, you're going to be a grandpa by the time we get to it.
Yeah, by the time you get all the doctors to agree on it. I'll do my part to help, but
yes.
Yeah. And then continuing on into the surgery. So that first part, the venogram went, smoothly. He said everything was good, and he even took the time to go out to see my sister and my girlfriend who were at, outside waiting for me, and tell them and update them. And I think that was like really important. And they expressed that to me. They were like, that was really, great, because we felt at ease that you were being taken care of too. And, I can't thank everyone enough over there. That was like, really great, really awesome. The procedure I think was like 2 hours, a little bit over that. I don't
Maybe
remember.
around
Something
that
like
time.
that. Yeah. And then I, was wheeled out. I was in the recovery room, and then the first thing my girlfriend, sensed, and she told me this later, she was like, I felt the color come back in your face. And, I was like groggy, and I don't remember any of this. I was just being told this. I was groggy. I was like calling to her and my sister, and then I was like, silence. And I would just like repeat the word silence over and over again. And I was asleep for a couple of more hours. I don't know. But yeah, it was, it was great. I still have the pictures of me on the bed and hooked up to all the wires and everything. It was, I will keep those forever. It was great. But I woke up, silence complete, and I would just ask everyone to shut up and just close my eyes and be like, I hear nothing. And that was, I think, I started, I think, tearing up and crying at that point, because it had been, a long time, May to October. And I know some people have had this for years, but to me and my personality, that felt like an eternity, and that felt like years and years and years. So, I was extremely thankful that I had found the solution and found the answer. And, in a little bit in the back of my mind, I was like, screw you to all those doctors who told me surgery won't help, and that's the thing
We'll
too,
delete
because
this from the video.
Yeah, we can do that. It was just I think it's not like an in your face moment. It was like why didn't you allow me to explore that? And I think that is the important part of what a lot of people were congratulating me for. They were like, you have been your biggest, medical advocate, because, you didn't stop to look to accept it or look, stop looking for different solutions. You tried a lot of things you tested on, you did, and everything like that. And that's, I think, the moral of that part of the story, I guess, doctor. So,
Well, that's
post-op,
a
I
big,
think. Oh, yeah, go ahead.
I didn't mean to interrupt you, sorry, but
No, no.
this is a big part of this process for you and from all the other patients. And at the end of the day, this is a group of diseases or group of disorders that the patients advocate for themselves.
Hmm.
And if they don't, many times they don't get the care they deserve.
Right.
Right? And I think you realize that, and there's thousands of patients who have the same problem, and everywhere in the world with this. It's just like conditions that often don't meet the typical checklist,
Hmm.
of a medical book or like a scientific paper, and they just never navigate this,
Hmm.
efficiently. And
Yeah.
and that's a another reason we have these conversations, and for people to see is that at the end of the day you have to advocate for yourself and keep asking for answers. And
Mhm. And I think a big marker to that too is when I did my MRI and my MRV eventually, both, the specialists who read my scans, said everything was normal. They didn't see any narrowing, they didn't see anything like that. And I don't think they're trained to look for it even. And that's kind of because it's not super common, and it's not something that people go and look for a lot, which is why, you don't see many cases pop up. I think more people are suffering from it than we know of. And that's, I think, a big part of trying to raise awareness to it. But yeah, to continue a little bit, just to the end of the story, I think, post-op, I stayed in the hospital, I think, for 4 extra hours after I woke up. They're just, monitoring me, making sure I was okay. And then I was, sent home with a small medication packet, my 30-day supply of blood thinners, just to, for the stent to grow into the vein. And I think I'm still, on my high dose of aspirin every day. That's, I think, till my 1 year anniversary of my surgery, so that will continue. But yeah, I mean, follow-up care, I did a 3-month follow-up with you guys. I did a 1 month follow-up, sorry, with you guys, via the phone. I did another 3-month follow-up with an MRV as well. Those, Dr. P looked and said they were great and they were normal. Kelly, you did my 1 month follow-up and, said everything was looking good. So I was pretty happy and, super content with it and everything that was going on. Residual effects, the first couple of months were a bit difficult, of like just me readjusting and, you know, having extreme anxiety of like this is happening again, or like, I can hear something. And, it was just, I think, my mind playing a little bit of tricks on me. Um, and I was back in the gym, I think 3.5 weeks post-op. And I was back there, and Dr. P said, take it easy, take it slow. And I have been, I think, I think 95% back to where I was in July, and I've actually, done personal records on bench press recently. So I'm going strong. I think my next competition I slated for August, so I'll be definitely sending Dr. P a medal if I get one, and getting everything ready to go
Yeah,
there. And sharing all the videos and pictures,
of
and
course.
it was tough. Just having a good support network was really helpful too. It was really hard, especially because my parents still live in Lebanon. They live abroad. So they weren't here to support. I only had, my sister who was also out of state, my girlfriend who was out of state, and, a couple of friends here who helped me through, helping me walk my dog when I couldn't wake up in the morning, or, making me some food and bringing it to me, just to know I was okay, because, it really caused a lot of depression and at some point, because I couldn't function as a normal human, I felt. Um, and then, over the past few months, I haven't felt anything. Like sometimes I would lie down when it's really super quiet, and then let's say my pillow would press on a vein of mine, and then, blood flow would, start pumping, and I would hear a couple of whooshes here and there. And I asked, Dr. P about that, and those are kind of normal. Maybe I have some dehiscence too. That could be
Mhm.
a cause of it. So it was nothing that said that it's back. So my veins are okay, and that was the most important thing, of like, okay, these are good. I'm fine. No tumors, no nothing, no, 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 nothing big, nothing huge. the stent is working. Like, once or twice I would get some eye pain or headaches, but it's never a pressure headache. It felt more like migraine. So it's like, okay, these are normal. I'm back to, normal again. So I'm still looking good, healthy. I hope Dr. P thinks so as well. I mean, I'm fine. Back, at work has been great. School has also been great, and everything has been, back to normal. So I'm really glad that I did go down this path, and I'm happy to help. It was funny too because I had like talked to the people in the powerlifting community about this issue and what I was going through because they were all asking me, "Oh my God, you're going to get surgery. Like, what's going on?" And you know, and then one of the fellow people who does powerlifting, I'm also a referee for one of the federations, and I volunteer with them. So one of my fellow referees said, "Hey, I have a friend who does bodybuilding, and he's experiencing pulsatile tinnitus too. Can he talk to you?" And I was like, "Yeah." So I've become this sort of like cult leader of like, okay, if anyone in the lifting community around Michigan has a problem, they come to me. And I actually referred him to Dr. P, and he did see him, and they discussed some, their own version of events, but it just goes to show too that like especially in these communities, like it's not super common at all, and like that's kind of I think the specialty of my story, I would say, which is why I'm here today. So I think that's it for me. Definitely, I would be happy to answer any questions if there's have been any, or Dr. P, if you have anything you wanted to ask me, and I can go through that.
First of all, thank you. It's very, very well said in the sense that more people are interested, I think, to hear about your feelings and about
Hmm.
your emotional journey rather than the
Right.
technical, surgical stuff. So I think that's good that you presented how you felt and how you navigated through this. Did you go back to the ophthalmologist after stenting?
Yeah, I did once. And that was just to do another eye exam. Oh no, sorry, I went twice. The first time I went, they did say, "Oh, you still have a little bit of like peripheral vision loss and stuff." And I was, still feeling fine at the time. But then you had recommended to go again. So I went again as well, and all tests were completely normal. Um, the test is super annoying when you put your eye in a patch and then you have to
Yeah.
look and press a button, and it was really annoying, but no, they had given me an all clear. And I was, I think, on Diamoxicil a few weeks after surgery as well. So just trying to wean off it a little bit too. And I mean, for back to the Diamoxicil, it did help, but it just made me miserable. So that was, I think, the biggest part of, why I couldn't keep doing it too. So yeah, went to the ophthalmologist, made sure like the eyes were okay because, I didn't want it to be a continuous problem. And that's something I think the aspirin is a bit helping with too, of like, at the time it was, like making sure I was calmer and the headaches were down and everything. So it was bringing everything down and good. So I think, the post-op medication care has been, spot on, and it's been working too. So I feel great about it.
And you stopped the Amox eventually, or are you still on
Yeah.
your dose?
No, I stopped it. Weaned off it. You had given me a protocol to do like 2 weeks half dose, and then eventually like one day on, one day off, or something like that. I forgot exactly. But yeah, I stopped it I think around the end of October, something like that. Or the first week of November. That was like right after our 1 month follow-up was when I completely went off it. And yeah, the first couple of days kind of sucked without it a little bit because I was so reliant at that point on it, even though it had only been like a couple of months on the medication. But yeah, once I, readjusted, it was all fine and all perfect.
Good. Any questions comments from you?
No, I mean, thank you. That was great.
Yeah, I'm
No
glad to help and share the story. So
questions.
I don't know if there were any questions in the chat.
Yeah, it looks like none so far. The what else could we discuss? I think something you didn't mention, and I don't remember exactly what you how you did is, do you have like a bad headache after the procedure? Do you have like any headache for a few days? Honestly,
Oh,
I
yeah.
don't remember that part either.
Yeah, I did have a headache. It wasn't too intense. You were telling me that, you may have a residual headache, and I was preparing for the worst, honestly. It wasn't too bad. I just felt very tired and sleepy, and, I was worried I couldn't fly back home, and that was also a big part of, you know, you were telling me, no, you can fly back in a couple of days, you'll be fine. Like it was okay, okay. I think it was just more like precautionary measures anyway.
Mm.
But no, I mean that even the higher dose, like higher effect pain medications that you guys gave me, I didn't even use. I didn't even need to at that point. So it was you know, it wasn't that bad and that terrible. Lying down, you know, helped a lot. Just making sure I wasn't on my feet too long as well during the day. I did take a couple of weeks off work after the procedure too, so you know, I was sure not to rush, and I had medical leave, so I was allowed to, and you know, I was allowed to like, you know, ease back into it and everything, which felt really good because I had, you know, I was able to do so. But you know, by I think day 4, day 5 post-op, I felt very fine to go and start doing things. I just didn't want to do it too quickly and like, you know, jeopardize anything or stop anything or get those headaches again. So I just started to ease into it. But yeah, I mean, the biggest thing that if you were going talking about a little bit about the emotional part of it, post-op, the biggest thing is the anxiety of like, is it gonna come back? Is it gonna work? And I think that was the main battle that I had after I got surgery, and that was, you know, a little bit more to do with my internal like struggle of, okay, I'm waiting to hear it. I want to hear it, and my brain is telling me, you've been living with this for 6 or 7 months. You are hearing it, and I, you know, I would just stop myself and say like, no, no, I'm not. And that was like a big part to come through, because especially with all the, you know, the anxiety and the down feeling and the depression while it was happening, because that was, I think, the biggest battle out of this all. It was just dealing with, you know, saying this is never going to get better, you know, this is, you know, always going to happen, this isn't ever gonna get solved or get changed. I have all these doctors telling me that they can't do anything for me, and that was, I think, the biggest emotional struggle for it, of, you know, just persevering and trying to not keep your spirits up, but keep the positivity of, you will find a solution eventually if you keep looking. And that was why I kept looking, because I knew that, you know, I have to do everything to find a solution, and that's what really kept me going emotionally. So
Here's a question. Did
Mhm.
you have any type of sensitivity? Not sure if they're referring to pre or post procedure, but like to light, sound, noise.
Yeah, I did actually. When I started having eye pain, really bright lights, you know, were very painful to look at. Like focusing on a computer screen for a long period of time at work also did. I mean, I have one of my kitchen lights. Me and my neighbor call it the surgical light because it looks like a big surgery bulb, and it's bright white. I could never turn that on for like a couple of weeks right before I started the Diamox. It was, you know, there was a lot of light sensitivity. Now, driving at night, I could drive at night with no problems. It's not like my vision changed. It was just more like it was painful to have my eyes open all the time. And that's kind of a little bit of a struggle of, you know, trying to manage that too while managing other things. And I was also at home all the time because I stopped going to the gym. So, you know, tried to stay in the dark a lot, a little bit. You know, became like an apartment mushroom, I call it. But you know, just staying inside. Um, yeah, that was sound. I don't think I had any sensitivity to sound. I think it was just the whooshing was dominating the things I was hearing. So even, you know, trying to walk my dog, I would try to focus more on the like, you know, the nature sounds and, you know, the birds and the trees and everything. At the time, while I was going through having PT, I did decide to see a therapist as well. And she had given me some breathing exercises where if I would like breathe and try to focus on something else, I would completely cut out the noise for like 10 seconds maybe, or 5 seconds. Otherwise, the only relief I would get from noise would be when I would press on my jugular vein, and that would kind of just, you know, stunt the blood flow up to my head, which would give me like 10 or 15 seconds of silence. Um, so that was, yeah, that was kind of from the noise aspect of things.
I mean, you know, you can hear, you know, you can understand when you know, we see so many patients. I think we saw more than 1,000 patients of pulsatile tinnitus in like 2 years. So
Mm-hmm.
I think we looked at the statistics recently. I mean, you understand, like, you know, how difficult this can be emotionally. And I think it's 2 or 3 reasons for it. And one is the actual, you know, actual noise in your head. And I think then everything gets worse, you know, because if you don't get like, you know, if people don't understand you, if people don't pay attention to this, people don't try to help you. And I think that just makes it's like a snowball effect.
Right.
And
Yeah, and that was a big thing. It was, some people not believing you and,
Yeah.
telling you you're crazy. Like, how can you hear
Yeah.
your pulse in your ear? Like, I had people snickering, telling me like, what is that weird thing that he's like hearing? Like, no way, or they just don't know about it. And that's like, I tried to, bring awareness to it and like educate people on it because I was going through it, and that was like the biggest part too of, that my that skull-based surgeon I saw, he told me, my recommendation is get on anxiety and live with it. He was like, I have some, I hear my pulse in my ear sometimes. And I was like, you're diminishing my feeling to something that is,
Yeah.
you would say common, or you would say someone deals with on a normal basis. And, that was a big thing of I couldn't accept, which is, where I think a lot of patients with PT fail, and not fail, but like they stop because they're like, oh, okay, so if the specialist told me this, then I should stop. No, you should keep looking. Um, that's the biggest thing.
It's very true. It's your dog.
Yeah, there he is. He's like been my guard dog at the
Agreed.
outside, but
What do you say? Okay.
yeah.
There's no more questions, and I think, I think we covered everything that I can think of, and I think this is great for, raising awareness, making patients feel comfortable, seeking questions, and I think
Oh, I see another question
there's
actually.
another one. What is this?
Yeah. Do I find myself keeping away from people because of the doubts? Sometimes yes. I mean, especially when it first started, people were like, I mean, what could be wrong? And they would always try to go to like a known medical reason, like, oh, oh my God, do you have a tumor? Oh my God, like, and going to worst case scenarios a lot. And I would do that too myself, but no one in my kind of circle really doubted me because, they know me as like a trustworthy person. I mean, I had no reason to lie. I would telling them, guys, I can hear something. It's really rough. Like, and they could see it visibly. And that was, I think, a big part of my kind of personal case was it really visibly affected me on the outside more than other patients, who I've seen through the Facebook group, through, there's even a pulsatile tinnitus subreddit on Reddit, there's a bunch of different things and avenues that I explored. So they could see that visibly there was a change in me, and that was, I think, something that led them to believe me more. In terms of the doctors who didn't believe me, I instantly, put an X around their name of like, yeah, I'm not seeing you again. Even though they would ask me for a follow-up, I would be like, no, I'm going to someone else because you're not taking me seriously. Or, maybe it's because they don't know about it enough. Maybe because they're not specialists in that kind of area. I'm not trying to say that they were doing this to me personally, but it was more like please listen to me. I don't feel like you're listening to me. And I got that more from the professional field rather than the personal, friends field, right? And family. So that was, I think, the biggest play of like just making sure if I felt that doctor didn't, not necessarily know what was going on, but didn't understand and kind of empathize a little bit with me, I would just move on to someone else. And that's where it led me all to back to Dr. P, I guess, because since then I've seen a bunch of different names, honestly, of like specialists and things that people have been seeing in different states too. But for me personally, anyone who has been going through this has asked me, and I've been saying like I went to see Dr. Patsalides in New York, and he was insane and amazing, so that's where I've been, advocating, I guess. Another question. Oh, thank you so much. Glad you're doing so much better. I thank you. I appreciate it really. And it's been quite a journey, and it's been and I think maybe I'm on the shorter side of people who dealt with this in terms of time and duration, but again, it just felt like forever, and that's where and why I just tried to go so quickly and as quickly as possible. And even then, the 2 weeks between appointments to see another doctor felt endless. So never stop, I guess, if you're going through it, is what I would end to say. Like, go and find someone.
Good. Thank you so much.
Thank you. I appreciate you guys having me on. I would, if you need me back here, I would be happy to do it as well. I will be sending you my videos in August though, so
Oh yeah,
you gotta look out for that.
you can train me.
Yeah, yeah. I mean, once I start getting coaching, getting coaching in myself.
Like almost the same age. Almost.
A little bit.
Yeah, you're like double, like two. Yeah. Okay. Okay. A pleasure seeing you again.
Yes, you
So
two
much
guys
for
too.
this is I think very important to a lot of people.
Yep.
And we'll make this a video and people will see this, and I think it's going to help a lot of people advocate for themselves.
Yeah.
It'll
Yeah.
help a
And I
lot of
hope I can
people
help.
reduce their anxiety about the procedure, perhaps. But the most important thing is that they know that what they go through is a real symptom,
Hmm.
and they have to keep looking for answers.
Yeah. And I'll end by saying, like, even if it's happening to you, don't give up super quickly. Don't lose hope. There are very many avenues. Like, do your research, get informed, I guess, about it, and then seek the right person to help. And that's a big thing, because a lot of the trend I've been seeing through the people dealing with this is they wait years to see doctors sometimes in different countries even,
Correct.
and they end up going to the wrong doctor, and then they have to deal with it all over again. And that's why, before you make that decision, make sure you're seeing the right person to deal with this. So
Okay.
yeah. Thank you guys for having me. I
Bye.
really
Have a
Thank
good
appreciate
you.
it.
night.
Good
And
night.
we'll see you at soon, I guess, maybe for my next follow-up. But
Yeah.
otherwise, thank you guys so much.
Be well. Take care,
Yep, you
Daniel.
too.
Thank you again
Bye-bye.
for all your help.
Yep, bye-bye.
Take care. Bye-bye.